morning, Fat Dissolve day today. Whilst I've been doing these treatments with you and going through everything to do with my eyes and just everything, I've noticed that my neck has got a problem. So today we're going to do the Fat Dissolve on it. I'm going to talk you through that. I'm going to show you how I do the Fat Dissolve on other people, but on me today. So I'm going to use this LipoLab. I like LipoLab because it's, as well as the ingredients are good ingredients. I'm not going to read that out for you because I can't. But basically, the fat dissolvers, and they tighten the skin as well. So that's what we need. I can't remember names of what tightens the skin. But it's a PPC solution, which has a skin tightener in it. I'm not reading it out for you because I can't. So, shall we just get cracking? I use these needles. I use the 2mm just when I'm doing the neck or anything. You can use these, but you're not getting much in them. Them are the 1mm ones. I use them for Botox and other stuff. But just for my neck, I'm just going to put, I'm going to use the 2mm. For if I were doing a big area like the body, I'd do, I'd use a 5mm syringe. You get more in it then, obviously. So I've got my LipoLab out, ready to go. I've got my sterile wipes, my alcohol wipes. Just being nosy. I'm going to cleanse the area for you. What I'd normally do with, if I had a client in, is I'd map out the area. So with a fat dissolve injections, you do them 1 centimetre apart. So you do them like a grid. I haven't got my pencil on me to show you, but so they need to be 1 centimetre apart because the solution spreads. So say I've got 4 squares across the neck, which I'm not going to touch now because so we do it in a grid pattern. So we don't go here where the Adam's apple is. Don't go past there. You don't need to. You don't need to be going down there. You don't go at the sides where the carotid arteries are. You don't touch there. You don't touch here with many things, really. Whatever we're doing aesthetically, nothing goes here because these are your carotid arteries. You don't want to make a performance there. This is your Adam's apple in your voice box. Don't go anywhere near there. We just want the underneath. So I might do a bit of my jaw as well, see if that... It probably won't because that's skin. Because I need everything pulling back now. So I'll drop him forward. It will look like a sharp hair dog. So anyway, what we'll do today is we'll do some fat dissolve up neck. So the needles I use are 30 gauge, 13mm. That's for the body, the 30 gauge, 13mm. For the face and the neck, we use a 30 gauge, 4mm, which is a mesotherapy needle, because you don't need it too long. With the 13mm, you need it that long to reach the subcutaneous where the fat lies. Because if you don't get right in to the subcutaneous and you use a smaller needle, or you pull it out as you're injecting, you'll cause a necrosis, which it kills the skin. You don't want that. The solution has to be in the subcutaneous. Now, with a 13mm, it is. You know that you're getting it. The 4mm, I'm starting to question myself. I've always used a 13 anyway on necks. I just don't go all the way in. And that's always sufficient. I'm thinking going for a bit longer than a 4mm for the neck. But in training, we'll do a 13mm on the body and a 4mm on the neck. Right, so I just filled it up. You wouldn't know. Well, you can do that. You just flick it off. When you're doing this, you'll once you've mapped out your neck, so you've done, say on the neck, I've done 8 squares, which is 8 separate injection points. Now, I'm going to put in bear in mind when you're doing out like this, these, how many mils in them now? 10 mil. Right, so you can only use 30 mil completely anywhere on the body. Your lymphatic system won't take any more than that. Cause all sorts of problems. So whatever you're doing, say you want to do your stomach and your neck. If it takes 30 on your stomach, don't touch your neck. Me personally, I would only do one area at a time anyway, just so it gets on your system properly and you don't have to mess about. Anyway, my point was, when you're measuring out, so you're doing 0. Say you've got, the amount of solution you use will depend on the size of the area, thickness, how much fat there is. So if you're doing a lady comes in or a gentleman comes in and they've got a little bit of fat on the neck and they're like, right, get rid of this. Me personally, I'm going to go at a 0.1 or a 0.2. So you can judge it. So you've got 10. If you only do one, it's going to be 10 on your syringe. So only draw up in your syringe what you're going to use. Because if you don't, so if you draw up 2 mil and you're only going to use 1 mil, you can't pour that back into your bottle. So you're going to have to use it anyway. Saves you money. And they're not getting a free treatment. It's as simple as that, isn't it? So, only draw what, it don't matter today because I'm just going to use what I want because it's mine. Yeah. So when you're doing so, just measure it out. So, I've got my 13 mil. Make sure there's no bubbles in it. So this is easier way to do it, right? So turn it on its side. Because otherwise you're losing lots of solution. Get the bubble right. Can you see? I don't know whether you can see. Your bubbles are right at the top. Just gently guide them out then. Can you see them coming out? You're not losing half your solution then. You're not losing half your solution. Always make sure you clean the area. Cleanse it properly. Yeah? Don't go here. So you can see where my problem is. That's where I'm going to go. Are you ready? So, I'm going to do it in mirror because I can't look at you while I'm doing it. So, let me put the big side of the mirror up. In. So, pushing your solution. It's a little bit stingy that. Ooh. So, go in, pushing your solution, stop, come out. In, pushing your solution, stop, come out. Don't. So, if you're an aesthetic, if you do aesthetics and you haven't done the fat dissolve, but you do fillers. So on some fillers, you go in, the linear technique, you'll go in and you come out pulling the filler along with you so it comes out in a line. It can get really awkward if you're doing a filler, then you're doing a fat dissolve and your mind just goes, pull it out as you're pushing in. Just don't do that. So I don't know if, oh, I forgot how stingy it was. Stingy. It's stingy that fat dissolve is. Not much. This Lipo Lab is not as stingy as Aqualix. Aqualix is stingy. You have to add lidocaine with your Aqualix. It's that bad. But with this you don't. You see where I've been? Oh, that is stingy today. Can't see where I've been now. Right, so you can see 1, 2, 3, that's where I've been. So now I want to go at the side of it, a centimetre away. Out. If your needle gets too stingy, it means change it. You're only supposed to go in with the needle about, I think it's 4 or 5 times before you should change it. I've done 6. Don't matter on yourself, but on your client it will. And they'll start feeling it, it'll start stinging. So, on your client, change the needle. Always keep your injection points clean as well. I mean, look at that neck. I don't know where it came from, why it collapsed like that. Why is it collapsed like that? Let's keep going. Because it's getting a bit stingy. I'm going to go in there. Middle up there. I'm going to change my needle because it's... Just change your needles. They cost pennies, your needles. They don't cost much at all, so... Just change them. Just change them. You can get a full box of 100 for about 15 quid. Which is what? It's not much, is it? Right, we've been there. It's awkward doing this on yourself. Because you don't know how old they... It's easier on somebody else, just in. When you're trying to do it on your... Right, here, you've got a main artery that runs down here. And you can feel it. If you do this, I can feel it. You know why? Can you see that? I've got like a little love heart-shaped mole or something, skin tag or whatever it is, on my face there. So I can feel the notch. But if you go like that, you can feel the notch of where this main artery is. And it runs down. So, and they branch off. So they come up, across, up. This is why it's dangerous when you're doing your fillers and stuff. You have to... I mean, people don't aspirate. That's their choice. But for me, aspirate. Because it runs right across your lip there. And don't ask me to name it. Labial. Because I can't. But just be careful when you're messing. So I'm going to go a bit away. I'm going to go away from that jowly bit. I'm going to go in there. Yep. Oh, it's stingy. Oh, Mother of Mary. It is stingy. What will happen is you'll find is your turkey neck that you were worrying about goes a little bit more turkish when you've done this. So it swells a little bit. It swells a little bit more. So don't worry. If you are having this treatment done anywhere and you think, oh, it's made it worse. It's not. If you just think about it, you've just been in with needles, so it is going to swell. It is going to swell. You are going to find some swelling. So that's with anything. So with this treatment, after you've done your, if you turn it to the side when you're trying to get your bubbles out, But I'm telling you, I wouldn't advise just randomly sticking... This is a disclaimer because I didn't do one at first. And I wouldn't advise just going out, getting yourself some fat dissolve, getting some syringes and some needles and just going for gold. I wouldn't advise that. Do some proper training first. Can be dangerous. You start putting air bubbles in you, and you start sticking it in wrong places. You've not put it in properly. You've not put it in deep enough. Can happen to anybody. I'll start bruising probably. That's because I'm doing it myself. Normally when I'm doing it to other people, I very rarely bruise them. Unless they are people that bruise anyway. But I very rarely bruise them. But I'll probably bruise myself because I'm doing it to myself, aren't I? So you can see... It's horrible getting old, isn't it? When you just want to... Every time you look at mirror, you think, oh, something else and something else. But at this point, just whack it in now. If you are training to do this, and you do put it in, and they do come up with a massive lump and it's blue or whatever, don't panic. You have it something, just give it a massage, it'll go. It's only a solution. It can't kill them. But it can cause necrosis. So, and do you know what I always find? If you pinch your client, it's a little bit stingy once it's gone in. If you pinch your client, it's a bit more comfortable when it goes in. The needle, not the solution. The solution does sting a bit, so if you really don't have a high pain threshold, it might not be for you. But it's stingy. It's not. It don't kill you. It's not gonna, You massage it as well to get it round your lymphatic system. That's the name of this. So what you want to do is, I've got a big chin, me. What you want to do is massage now. It's getting into them fat cells. It's destroying them fat cells. And what you want to do is then get it. You know when you hear people say when you have this done or it comes out in your wee, you're fat. It does, but it's not. It doesn't break down and then you go for a wee and your fat's coming out. That's not how it works. It gets in. It blasts the fat cells. That it then gets carried away through your lymphatic system, and yes, it will come out through your wee when you're having a wee. But see, now I've got some left. I'm going to have to go in again because I can't put it back in my bottle. So let's put the big side up on the mirror so we can see where we've been. I hate doing that because then you can see more things in your face and you don't want to see them, do you? You don't want to see them. Look at that. I mean, I don't know what happened there. I don't know what happened. All of a sudden, my neck collapsed. I'm going to go down here. Stingy. Put a bit. Oh, that. Tiny little bit now. What should we got? Let's go back in here. Gullet. What are them birds called? What have a gullet there? What are they called then? Are they them what carry them babies? Stork. That's what my neck looks like. One of them storks. Stalky, stalky, stalky. I'll get another, oh, bleeder. I'll get another sterile wipe out. Oh, that stings. If you get a bleeder, just keep pressure on it until it stops bleeding. If it starts pouring out, phone an ambulance. But it won't. I don't think it will anyway. Right, I've got the tiniest bit left. I'll put it there. And that's it. That's your fat dissolving done. Fat dissolve, done. Now, keep the area clean. Keep it sterile. Don't go to any saunas, any gyms. Because them wounds are now open. They're open, them wounds now. If you could see them under a microscope, they'd be massive. So just relax after you've done it. Don't put any makeup on. Makeup causes infection. So, don't know if you can see that. You see that lump? Blue lump. You see it? That were attractive, wasn't it? That can happen. You still see it. It'll go. It'll go. It's just solution. So keep the area clean. Give it a massage every day. Put a glove on if you can. Just keep massaging it in. And hope for the best. It's a fair lump, that. Just massage it, it goes. So that's that. That's your fat dissolve 101. If you've any questions, just ask. But that's it. Excuse me, I've got wind today. Yeah, that's it for your fat dissolve. I've given myself a couple of bruises. I can see them, and it'll be swollen. Tomorrow it'll probably be a little bit swollen, but it'll go, and hopefully it'll take my turkey neck away with it. If not, just leave it a couple of weeks and then go in again. But thanks for watching. If you like my videos, like and subscribe. And then I can make more videos for you. If you don't like them, just scroll along. But yeah, thank you very much for watching. I'll see you again soon.